Hello beautiful people, you're welcome to my YouTube channel, Hosanna's Vlog. If this is your first time seeing this face, this is Hosanna. You're welcome to my channel. Please remember to watch, like, share and subscribe to my channel, and also turn on the notification bell to always get notified whenever I post a new video online. Thank you so much guys, and my old internet subscribers, this guy is super grateful, and I love you guys so much. Thank you guys for coming back to this channel and watching my video. I am so grateful, believe me, and thank you so much. So today guys, I'm talking about PCOS, and I'm going deep into PCOS today. I've actually been talking about PCOS a long time ago, but I've just been saying stories of how I was diagnosed and all this stuff. But today I actually want to go deep into PCOS and explain to some people what PCOS is all about. Because I've gotten the questions, PCOS. I'm going to just go deep a little about PCOS and actually let you guys educate you guys on what PCOS is from experience. You understand? So listen attentively. Guys, what is PCOS? Polycystic ovarian syndrome or polycystic ovary syndrome, is a hormonal imbalance that causes enlarged ovaries and then cysts at the outer lining of your ovaries. It's a hormonal disorder that causes enlarged ovaries with small cysts at the outer edges of your ovaries. You understand? So some people will be like, which one is enlarged ovaries? Now, if this is not something you can just look at your stomach and see, it's something that you need to go for a scan to be able to detect or to be able to see if there is PCOS in it. I think I have to actually go and get checked for one of the scans I did that has a picture. Maybe I can post this and you will see what I mean by cysts on the outer edges. If you go for a scan, you actually see those cysts at the end to be small around. If you're not even careful, you might think it's egg, but it's not eggs, it's cysts. So you can only detect that when you go for a sonogram, a scan. That's when you know, or you see those cysts I'm talking about and the enlarged ovaries. That is PCOS. So some people will be asking, what are the symptoms of PCOS? What are those things that I need to see? And I'm like, oh yeah, I need to see a doctor. This is actually the signs and symptoms of PCOS. Like, this thing is happening to me. I think I need to see a doctor to confirm and be sure that this is not PCOS. Number one, irregular menstruation or amenorrhea. Some people have irregular menstruation. It will come this month, it will not come this month. Some people don't see at all. For someone like me, I don't see my menses at all. The only time that I see blood is maybe because it's hormonal imbalance. I might start bleeding and it will come for like a month or 2 months, just like that, probably spotting. So number one, irregular menstruation or amenorrhea, that's absence of menstruation. Number two is excess hair growth, probably in your pubic areas, your body, your hair, excess hair growth. Number three, the acne, that's the pimples and rough faces. If you look at me, you will say, I get enough, or as in there's too much pimples on my face. Number four, obesity, that is having body, even if you don't eat anything, even if what you say you eat maybe once in a day, that obesity, that big body, that's one that PCOS does to me. Then, deep voice. If you know me like 5 years ago, I had lighter voice more than this. But PCOS is saying, okay, because of the fact that most of the times our male hormone grows or gets bigger than our female hormone, it rises more than our female hormone. So we tend to develop male features, that's the excessive hair growth and then the deep voices. So because our body tends to develop male features more because of the male hormones that are rising more than the female hormones, we tend to have these deep voices and the rest. Now, another symptoms of PCOS is the scalp hair loss. Some people stop growing hairs, and probably the ones that they have might start falling off. You understand? PCOS can actually do that to the human body when you start losing your hair from your hair. You understand? So these are the symptoms that you need to have or get to say, okay, I need to see a doctor. This might be PCOS. You understand? People will ask, are there treatments for PCOS? for now there isn't treatment for PCOS, but there are some drugs that are given to women to be able to control what they feel or symptoms that comes to PCOS, or to regularize a lot of things in their body, since there is no cure for PCOS. But you know, the fact that this is a hormonal imbalance, it scatters a lot of things in your body. So there are drugs that are given to women to be able to help them control a lot of things. Number one is the birth control pills. Birth control pills help women to be able to regularize menses. When you take birth control pill, you'll be able to change your menstrual cycle a bit and help regularize it a bit. It works for some people, it doesn't work for some people. So because for me, when I tried taking the birth control pill to regularize my menstrual cycle, it became worse. I started bleeding excessively with pains. So trying the birth control pill, it didn't work for me. So I stopped taking the birth control pill to regularize my menses. You understand? So it works for some people, but this is what it's meant for. Birth control pill to do what? To regularize your menses. Secondly, is metformin to stop diabetes. Now, anybody that has PCOS is at risk for diabetes. So because of the insulin resistance in your body, PCOS comes with insulin resistance in your body, and because what your body is supposed to do, the hormones of your body are supposed to control those things, are no longer working the way it's supposed to be, you are at risk of having diabetes. So they give you metformin to be able to reduce any effect that will cause diabetes for you. So you take the metformin to do what? To avoid diabetes. Thirdly, one of the things PCOS does to the human body is, as a human, you won't be able to ovulate. And when you don't ovulate, you can't take in. You understand? For the fact that you don't menstruate, because obviously PCOS stops your menses. So that is irregular or it doesn't come at all. So because you don't menstruate, you can't ovulate. And when you don't ovulate, you can't take in, no matter the amount of sperm that goes into your body or tries to hatch any egg. Probably there might not even be egg for the sperm to be able to hatch. So when you don't menstruate or ovulate, there's no way you're going to take in. So the hormonal drugs help for fertility. It helps you for fertility. Now, this is it. When you want to take in, when it's time for you to take in, depending on your own process. For the people that menstruate but they don't ovulate, I don't know how it happens, but they menstruate but eggs don't hatch. Eggs don't get to that point where they have to hatch, probably on their ovulation day. So what happens is, since those eggs will not break on your ovulation day, it will not extend with more days. You understand? That's when you have irregular menstruation. You're supposed to see your menses 28th of this month, right? Because you're having PCOS, what happens? Your egg will not break on the 14th day, which is your ovulation. It will not extend probably your 20th day to break or for the menses to come out. That's irregular menses. If this happens, there's no way you can take in. But what the hormonal drugs does is this. Once you take that hormonal drugs, for someone like me that don't see my menses, what happens? I have to induce menstruation. When I induce menstruation, after on the second day, I have to take a tablet to help boost my egg, to help your egg to be able to grow and mature. Then, on the 12th day, since I have a 28-day cycle, on the 12th day, I have to take an injection that will help me break my eggs at exactly 48 hours. And that 48 hours is when? On the 14th day. That's my own process. So now, all those things are hormonal drugs. This is what it does. It helps for infertility. A lot of people will prefer the tablets, right? A lot of doctors will want to give you the tablets. Some will prefer the injection, depending on what works for you. Probably they have tried the tablet for you and it doesn't work. Like me, I've tried the tablet and it didn't work. So what they did was to use the injection, and that is what worked perfectly for me. So what does the hormonal drug do? It helps you to be able to take in. And that process that can be used is procedures. Yeah, procedures can be a lot of things, but the most common procedure that we know for those that have PCOS is waxing, because you shaving is stress. I think when you shave, I think the next time that those hairs are going to grow, they're going to grow times 10 of the ones that you even had to shave out. So people prefer waxing because when you wax, it takes a lot of time before those hairs will grow, and even when it does, it will not grow as big as the other ones that you shave. So people that have PCOS prefer waxing to everything. Now, PCOS being PCOS, since we have our male hormones being more effective than our female hormones, we always have excessive hairs, as I said earlier. Now we have hairs, just those places that male have hairs. Here, that's the mustache, and here our normal beard. We have hair. I think I even have. I started noticing one hair that like one coming out here, and I'm like, I'm not going to touch it. If I try and touch it, the next one that is going to come out to be more than one. So I didn't touch it. Now some people, it's not just one hair. People are like, for some women, we have like just the way that men have beards. Some women have it like this. So for me, my mustache, I just have that black sign here, like black. I don't know if you can see black sign here, but no hair is coming out. But I have this black. Even if I want to rub makeup, the black sign is like evident. You can actually see it. So if I'm actually going to do my makeup, I should be able to add more powder to that part to be able to cover that black mark that shows there. So PCOS being PCOS, it always gives you that excessive hair. You understand? So the procedure is what? Waxing. That's what they use to be able to reduce excessive hair growth. A lot of people keep asking this question: are there complications that comes with PCOS? Yes, there are. There are complications that comes with PCOS. Most of them are life-threatening. Most of them are just normal complications that come with PCOS. Number one, like I mentioned earlier, is infertility. Infertility is a complication because how can you as a woman get married and you don't give birth? And even when you try to take in, you go through a lot of procedures just to take in. One, infertility is one complication that comes with PCOS. So the second complication that comes with PCOS is what? Miscarriage and what? Premature death. So the third complication is what? Type 2 diabetes. Now, since we are having insulin resistance because of the hormonal imbalance we are having, we are at risk of developing diabetes. Because you know, when you take in sugar in your body, I think the insulin should know what should be able to moderate and remove the excess and be how they do it. But since we are having insulin resistance, it doesn't work in our body. What happens? All those sugar that we take in pack and stay one place. And it's not our fault. I just want to be PCOS, and I've asked why I have PCOS. We have these cravings for sugary things. We always want to take things. We just have this cravings to take in sugary things because you know we have sugar moderation in our body. It doesn't work anymore. Both moderating it though, but so we crave sugary things a lot. And what happens? We will not crave that sugary things enough. And when we take it in our body, what happens? Our body doesn't moderate or normalize it the way it's supposed to. So what happens? We develop type 2 diabetes. So most people that have PCOS are at risk of developing type 2 diabetes. That's what complication that comes with PCOS. So the only thing there is, as someone that has PCOS, you need to actually check yourself all the time. Both the fasting blood sugar and normal blood sugar, you need to actually do those tests to be able to be sure that you are okay and you are perfect. And that complication that comes with PCOS is what? Eating disorder. Now, I don't know if it is eating disorder works for is. I don't know if it happens to every other person, but mine is, I think maybe I prefer eating the junks to the normal food. Maybe that's the eating disorder that I have to do when it comes to my own part. I prefer eating the junks to eat the normal food. I can at least stay a whole day and I will not eat a normal food. I will not eat those food I'm supposed to eat. But I'm comfortable with the junks. I can eat the junks enough. You understand? So we have this eating disorder that it's not that we are eating too much, that we need to be eating all the time, or we don't even eat that. For someone like me, I don't even eat much, but I do more of the junks. Doesn't mean that PCOS does to me. I eat more of the junks than the normal food that we need. By every start, I don't get hungry. I might stay and I'm not hungry. But once I see junks, I have to take it. Even when I'm not hungry, I just need to take it in my stomach. You understand? So that's one thing that comes to PCOS. But I call it's a complication because this is something that you don't do, and all of a sudden you're actually doing it all the time, and it's a risk. The next complication that comes to PCOS is what? Sleep apnea. And this sleep apnea is almost like a sleeping disorder that you stop breathing repeatedly. Like you stop breathing and start breathing again. Like on and off all the time. You repeatedly stop breathing and start breathing almost like immediately. That's a sleep disorder. And one of the symptoms of this sleep apnea is you snore loudly. You snore very, very loudly. And then when you wake up in the morning, it's almost like you are so tired, like you are so, you know, when you not sleep, even if you have slept for 10 hours and you wake up, you are so tired. Even if I don't know whether it's the snore that you have been snoring, or the fact that you keep breathing and stopping repeatedly. So I don't know what makes you tired, whether it is the fact that you sleep and stop breathing repeatedly, or you snore loudly. So this is one complication that comes with PCOS, sleep apnea, where you have to snore loudly and then get tired all the time, and then you have to stop breathing and start breathing repeatedly and all this. In all this, one thing I need to let my ladies or my women understand is it is not your fault that you have PCOS. It happened. So don't blame yourself. I didn't include depression and anxiety in the complications because this is the ones that will bring upon ourselves. It is not your fault that you have PCOS. It is not like your sins and God is trying to punish you with PCOS. No. This is just something that happened. Maybe due to genetics or environment that you see yourself. It happens. So don't blame yourself that you have PCOS. It's not your fault that you have PCOS. So don't lead yourself into depression or risk alone or start having anxiety because of it. I actually felt that way because for someone like me, I don't know what PCOS is, and all of a sudden I stopped seeing my menses and started having all these things from here and there coming in, being on drugs or injections. I had this depression. I understand it perfectly, but stop blaming yourself for it. It is not your fault. And my men out there, if your wife has PCOS or your girlfriend has PCOS, this is a time to be very, very supportive. I know what you're scared of. This one that have PCOS. Are you sure she'll be able to give me a child? You are going to have a child. You will have a child. The only thing that actually delayed me having a child is the fact that I didn't have all this knowledge. I didn't know all those things that you have to do for you to be able to take in with PCOS. You know, one thing with life is you learn as you go. You learn in the journey. Even as you keep growing and you keep experiencing things, you keep learning on that particular thing. So I learned on PCOS. I learned on this particular journey. So it is not her fault that she's having PCOS, and you are going to actually have your own children. The only thing there is that procedure you're supposed to take it and take it. Don't miss any step, and you see that you won't even have to stress yourself. Now I have another problem. A lot of times women have all these symptoms and they leave what they're supposed to, that is going to a hospital to get diagnosed and start going to churches. It's not as if I don't believe in miracle, right? I believe in miracle perfectly. But when you know the right thing to do the right thing, when you see all these symptoms, go to the hospital and start treating yourself. You can probably combine going to the hospital and probably praying. Nobody says you shouldn't pray. But don't leave the right thing you're supposed to do and be doing the things that is necessary, right? Yes, but do the right thing at the right time. You understand? So, guys, everything will be fine. This is just the vision that comes. You'll be fine. PCOS is just a name. You know, go pass. You cannot pass that name in that stream. Thank you guys for always watching this video. Thank you guys for actually watching this video. You can actually share this video on your timeline for someone that is going to help, or someone that is of need or in need of this video. I don't have to put English. Someone will actually need this video in your timeline. So share this video when you're done watching. Share it on your social media accounts for people that really need this help to be able to get this help. So thank you guys for watching this video or for watching this video. I love you guys so much. Peace. See you next time.